Today we have a very special episode of the Dr. Joe Show, an interview with former registered nurse and midwife Megan. She's got some heartbreaking stories to tell of her experience working for over 20 years in a hospital witnessing abortions. You're not going to want to miss this. That's today on the Dr. Joe Show. So, Megan, thank you so much for coming on the Dr. Joe Show and for being ready to be interviewed. Could you just tell us how long you've been a midwife and nurse for?
So I'm a former midwife and registered nurse. Mm-hmm. I finished my nursing in 1997 and I did my midwifery in 2007. Mm-hmm. So
how many years have you been working in the hospital?
I would say across positions over 20 years, definitely. Mm-hmm. 30 years with breaks for having children and so forth.
So in over 20 years as a nurse and a midwife, what have you seen in terms of abortion?
So abortion, I've seen a lot. In regards to what we do as a midwife or nurse when we're dealing with stillborns, miscarriages and abortions, it's the aftercare is pretty much the same. So
can I ask you, did you participate in abortions? I
was pregnant for that 2000 and some of that 2007, so they didn't let me do the deliveries of stillborns. But the aftercare I did, yes.
Of these babies that had been killed.
Yes, so I had to clean them, dress them, and we're talking about 14 to 17 week pregnancies at this stage, and then beyond that as well, but you'll treat them the same. So yes, we wash them, we clean them, we check them over, we check the placenta over to make sure it's complete. We take photos, we do handprints, fingerprints, dress the baby up in case the woman would like to spend time with it. Wrap it up. If it's before 20 weeks, we do a mock birth certificate, and all that information, including the blankets that the baby was received into, is packed away into it's filed away into a little memory box, because what happens is later on down the track, women seek mental health help, and to heal from their trauma of having abortions and miscarriages and stillborns, they come back to the hospital and want to see their information. That memory box is actually offered to every single woman at the time, and I'm assuming that because I worked for New South Wales Health, it's across the board because we have all the same policies and procedures. So if the woman decides not to take that with her, then yes, it's filed away, so at any stage they can come back to the hospital and access their records and obviously those memories to help with her healing journey and especially the mental health aspect from it. The thing with being a nurse and a midwife and looking after women, I've never actually experienced or seen any staff member, any nurses or midwives treat any woman differently. We're very, our views and our opinions on anything doesn't carry over to our professional role, because obviously it's a sensitive topic and we're working in a sensitive area.
In your 20 years working as a midwife and a nurse, what's the worst experience of abortion that you've had?
Probably twins. I can't tell exactly. They were between 14 and 17 weeks. The reason for that elective termination was because, how do I put this? There was a slight chance at the NT scan that one or both of the babies could have had something wrong with it, and it was a very, very small ratio. Generally, when we have our nuchal translucency scans, the 12-week scans, you get a ratio based on your age and a whole range of different things.
So the probability of the child being disabled?
Yes, exactly right. So just say someone got like a 1 in 200 chance that one or both of those babies could have been born with Down syndrome. There's also 199 chances that there's going to be nothing wrong with the baby. And in this case, there was nothing wrong with both of those babies. They were little boys.
How do you know there was nothing wrong when you delivered them?
They were completely normal. So I didn't do the actual, I didn't receive the baby, so I didn't do the actual birth.
Yeah.
I did the aftercare. So I came in just on delivery in the morning.
Before we get to that, the aftercare, could you tell me how these two little twin boys were killed? What was the method?
So the only way I've seen it is a forced misdelivery. So when I say that, they generally give medication to the woman to dilate the cervix because they're very small at that gestation. It's easier for them to pass through the birth canal, so they don't have to have a lot of medication for that happening. Generally, when the cervix starts to dilate and the uterus starts to contract, the babies come out that way. And
so they bring labour on early.
They bring labour on early,
knowing that the babies or the baby won't survive because they're pre-viable.
Yes. Yes.
Wow.
Yep.
I wonder what that's. Do you have any sense of what that would be like for those babies?
I believe that I've seen very premature babies have the biggest characters and personalities, and they'll pull their little tubes out. And even one of my own children, when I was having the 12-week scan, was spinning around and had this little personality and would move away from the noise of the ultrasound. Or you can just imagine there's some kind of sensation for them. And I think that they do have an awareness. So, I can't imagine what it would be like to be nice and cosy and then it's just ended. So,
and these twin boys, so there was a small probability that they would have something wrong with them, and the mother went in for the abortion.
Yes, she did.
And then they brought labour on early, and she delivered her baby boys dead, stillborn.
Yes. So it's just an induction of labour. The thing with pregnancy, it doesn't matter from the time of conception. Every single pregnancy and every single woman carrying has to go through a birthing process, whether that's a cesarean, a vaginal birth. It doesn't matter what gestation, you still have to go through the same thing, and also afterwards as well.
One of the big things that people say is that if you're against abortion, you're a forced birther, but what you're saying is that women have to give birth anyway.
You have to give birth anyway. You cannot get out of it. And whether it's surgical or naturally, whatever, that's what has to happen.
So with these twin boys, another one of your colleagues delivered them, and then you were responsible for the aftercare. What was it like holding them, seeing them?
I still remember it to this day, which is a story that I can share. It was horrid because they were perfect. They had little fingernails. I did their handprints and footprints. You can imagine how tiny they would be. They had arms and legs, a cute little face. Two of them identical, both of them. I had to carry those two babies on ice cream containers. So when a miscarriage or any kind of stillbirth or abortion happens, the babies are actually transported in an ice cream container. So the white ice cream containers without the ice cream logo on it, that's exactly what's used. So I had two of them, and I was 7 months pregnant, and I put them on my belly to carry them to the morgue.
Wow.
And when the lady...
Do they have a lid on them?
Yes, they do.
Wow.
Yeah, they do. Yeah, they do. But it's how you could it's exactly the same. Looks exactly the same. And I think people are horrified to know that, but that's the reality of it. And the morgue attendant was quite horrified that I was pregnant myself, and she said, "Oh my goodness, why did they let you do this?" The luck of the draw.
Yeah, wow. And she would probably see a lot of these babies.
Yes.
Yeah.
I cannot imagine what they,
Do you know what happened to those 14 to 7-week-old twin boys after they were in the morgue?
I don't know what happens now, but from my knowledge, before 20 week, a funeral is not legally required. So the woman can have a choice of whether or not she wants to have one or not. And it's generally they have to organise it themselves. So,
and if they don't?
Then it's just disposed of.
What do you mean?
So as medical waste, where whatever they do with everything that goes to the morgue, and it's not a human being for a funeral, they're destroyed as medical waste.
But these are human beings. These are little boys.
Yeah, little boys. They
dumped in the bin.
I often think about some of the cases like, oh, they would be 18 now, or do you know what I mean? It's and we're supposed to be so impartial. I don't know many people that could do that over and over again and remain impartial, especially when I don't think the woman is going in fully informed, and that's the main reason why I'm speaking out. One, to prevention, and two, to be fully informed and to educate women on exactly what happens.
Yeah.
So...
Wow. I don't know how you process something like that when you've got your own baby inside of you and you're holding these two little boys who've been killed.
Yeah, it's hard. It's hard. And in the same respect, in the next room or the next bed, we have a woman begging and pleading to save her baby, knowing full well we can't. Seeing doctors go and nurses go to extreme lengths to continue a pregnancy so the woman can have a healthy baby at the end. It's just wild what they can do. And then we still have to remain impartial to the ones that choose to end pregnancies and end their babies' lives.
Is it hard on the midwives and the nurses that, you know, on the one hand you're doing everything you can to support a woman to carry that baby, to birth that baby alive, and then in the next room you're deliberately delivering dead babies? Yeah,
extremely hard, especially when it's for social reasons. I understand there's situations where that procedure is necessary. The woman's life is in danger, or the baby's life's in danger, or it's not compatible with life, or it's a sexual assault or something really terrible, and I understand those reasons, but it hurts my soul to know that it happens for social reasons or because it's the wrong sex.
I think the wrong sex. Have you seen that?
Thankfully, no, I haven't.
Yeah. I think most people would probably be surprised to hear you say abortion for social reasons, because what you hear from the media is these were all medically necessary abortions. In your experience, were you seeing a lot of social terminations?
Yeah. Before 12 weeks, that's the majority of them for that reason. We can just look at statistics, but it's not tens of thousands of rape victims having abortions. It's people that have, for whatever reason, they can't have this child and they decide against it.
What's the impact of being around these little babies who've been killed in this way? How does it make you feel? How do you sleep at night?
It's soul destroying. It really is, because you carry all this trauma yourself on, and you're forced to be impartial and not have opinions, and obviously I treat everyone with respect, but when you're seeing senior midwives burst out crying at handovers because it's their third stillborn that week, it's really hard to take. And it does. I don't know very many nurses or midwives that wouldn't be affected by a dead baby.
And when you say third stillborn that week, do you mean third deliberately induced stillborn that week?
1 out of 3 was, yeah. The other 2 were stillborns, but I specifically remember that day because I didn't know what to do. You become so desensitized at working in healthcare that you start to suppress your true feels on situations, and this poor midwife just burst out crying because the experience of dealing with a lifeless body, let alone this tiny innocent baby. I tried to do whatever I could for that little soul, even though it wasn't here no more. So when I would walk to the morgue with them, I would, the hospital I worked at, you had to walk through the main entrance so everyone could see. I would push them in their little thing and cover them up and have a hat on them so they just looked like they were asleep. I've carried them down in my arms and cradled them. On the way in the lift, I remember singing to some of them and just kind of, I don't know if it was for my benefit, it probably was, that at least they experienced some kind of love in their existence.
Yeah, and I think that's the humanity of these babies, right? Like you're responding to their humanity. They're not medical waste or trash. They are a person.
Yeah.
Did you feel that midwives and nurses didn't want to do abortions, that they weren't traumatised by this?
Yeah, absolutely. Yeah. And they generally rotate staff around, so we're not exposed to that on a continual basis. Yeah. So the senior midwife who was clearly upset over having her third non-live birth, she got a lot of patients instead, because they have to factor in our feelings too. It's going to get to a stage where people are going to refuse to look after them, and what's going to happen is you're going to get substandard care. And by that I mean we have a lot of skills shortage, people from overseas that'll come and do it, so they're purely there for the money. And a lot of us will just say, you know what, this is not for me anymore. I care deeply about women and women's health, but this is too much to take on personally day in, day out, especially when you're dealing with these extremely sad situations and you have to go home to your own family. I was pregnant as a midwife. And it really does affect you.
So a baby who is deliberately killed, if they're aborted, there is aftercare with those babies. Could you tell me what it's like to do the aftercare and what that involves, what you're forced to do?
So you clean the baby, you check to make sure that everything's okay, as in everything's there, meaning that their arms and legs are attached and they're complete, as well as the placenta, and you document that because that's really important.
Is that to make sure that none of that's left inside the mother?
Exactly, because the risk of infection with retained products is extremely high. So it's very important for the mother to make sure that everything's there. You dress them, take photos, do their hand and footprints. So can you imagine a little handprint of a 14 to 7 week old little fetus? If they've got hair, some babies have crazy amount of hair. It's insane. You take a little lock of hair.
And so you do that even for the babies who are aborted?
Even if it's a miscarriage after a certain gestation, you still have to inspect what's there to make sure it's all there.
Yeah.
So, yes.
But also not just a natural miscarriage, like an actual abortion. Yeah.
I don't know what happens in clinics because I've never worked in one, so I don't know if they follow the same procedures.
You've worked in the hospital system.
Only in the hospital system. So it may be a little bit more regulated there. But, we have to inspect that.
Yeah.
Just like a normal a live birth, we inspect the placenta. We have to check to make sure there's nothing left behind.
What are the women like after they've had these abortions? Do any memories stick out for you?
Probably the twin woman was very cold. I think she was completely disassociated to what was happening, and I often think, how is she doing? Because that was 2 healthy babies that she opted to terminate. She opted to end those 2 healthy babies' lives based on probably information that wasn't completely accurate, or the amount of testing wasn't done properly. I don't know what happened before she came to where I saw her. So, and I also think was a bit of a language barrier too. So a lot of women, actually I would say most women are extremely upset. I don't think they realise what's involved with an abortion, how you feel afterwards, how painful it is, and things like the bleeding. It's exactly the same as if you were delivering at term. So I think it's a little bit of a shock for them to go through that. Most women go through it alone. Very rarely do you see a man there.
Wow.
Yeah, very rarely. In fact, I have been to clinics as a support person several times, and I didn't see any man there. Most women were by themselves, and it's kind of sitting in the waiting room and everyone's looking at each other, not knowing what to do or say, and just trying to work out what they're doing in this completely alone environment. And when they have the procedure, you're also alone. So there's no one holding your hand. There's no one supporting you through that. You go in to a room, you have it done, and you come back out. And if you're lucky, you might have a girlfriend that's taken you, as I did, for other people to support them. But I was trying to think if I ever saw a father or a man, and I can say no, I didn't.
Wow.
I didn't at all.
Yeah. There's data to suggest that in the US where they collected, I think it's something like 86% of women who go into abortion clinics don't have a supportive partner or just even a partner with them. And so I look at that and think, well, if men stepped up or, you know, we would probably have less dead babies.
Well, exactly. And I think that men have to be held accountable too. You're playing with fire by having unprotected sex with someone that you don't want to have a child to. That's a huge commitment.
Yeah.
But
Can I ask you about other experiences of abortion that you've seen or witnessed as a midwife and nurse?
Okay. I have supported someone who had a chemical abortion at home, and I would have to say that is horrifying. It was a 2-week process. You get prescribed this is not the morning after pill. This is when someone's already pregnant, and before 12 weeks, you can have, if it's early enough, you can have a chemical abortion.
Yeah.
So you get prescribed medication to do exactly that. And what happens is you bleed continuously for days, and you slowly pass the byproducts of that pregnancy out over that time, which in itself is quite horrifying for women to deal with. Yeah. And again, completely alone dealing with that. I couldn't believe that process went for so long. Yeah. It was almost cruel that that's acceptable to treat a woman like that.
Yeah, and I really feel like they lie to these women because, you know, Teen Vogue describes it as just having a light period.
No.
Taking MS two-step.
I can tell you now it's not a light period. The aftermath of a termination is exactly the same as if you had the pregnancy go to term. It's a couple of weeks of bleeding, it's blood clots, it's pain. You go through the labour process. It's even with a termination in a hospital or a clinic, and you go through that procedure and they give you pain relief, it's still not enough. As you know, if you're having children, nothing takes all that pain away. It is so. But
I often think about that because at least there's a lot of pain involved in pregnancy and labour, but at least afterwards you get your little baby. But for an abortion, you've got a woman who's had to go through all of that pain. And she's got a dead baby, which I think in her heart she would feel, and it's a legacy for her life, you know, that's the case.
Yeah, exactly. And the important thing is that no one's looking at the support. Everyone says, oh, it's a woman's choice, my body, my choice. Where are all those women helping out with these abortions and doing the aftercare and sitting with the woman and trying to comfort her, because it's an extremely lonely existence for women to go through through this procedure. There's a lot of shame in it as well. So no one's reaching out for help because then they'd have to acknowledge what's happened, and that's where the accountability and consequence comes into it. For me, I'm so concerned about the level of STIs that people are having unprotected sex. The best result is a baby. That's a pregnancy is the best result because in this country alone at the moment, syphilis and inherited syphilis is actually on the rise, which means women are not getting their STIs treated. They are having unprotected sex, and I think we need to look at the education and prevention so it doesn't get to this stage. So we don't have to have women having terminations at such a late stage or even at all. And we can leave that procedure to women who genuinely need it for medical reasons.
Yeah.
And I've seen that. I've seen someone who chose to have an abortion of a baby that was not going to be compatible with life.
Okay.
I can understand that. I've also seen the exact same situation of a woman saying, I'm going to give my all to this baby and hope for a miracle, and the baby lasts 12 hours because it's not. The actual procedure, there's a need for it, but I think the abuse of that puts those women that are at risk because of their health or because of the baby's health at even more of a risk, because there's a backlog in theatres already in hospitals. It's crazy at the moment. And because there's a time limit on doing these things, if you're pushing through abortions before you're pushing through a woman who's about to go in for a cesarean, or a woman that's miscarrying and being told, we can't do your D&C today, we're going to have to wait till tomorrow because we're too busy, but there's 5 women having social abortions before her. And this poor woman that's having an active miscarriage just has to tolerate and go through that for another, for longer. And I think as women, if we really care about women's health, we'll care about all women's health, not just our own, because that's when it becomes extremely selfish. Yeah. And the whole reason why I'm here, because another selfish thing is sex selection abortions. Over 21 weeks, I can't even comprehend how someone could make that decision to abort a healthy pregnancy, a healthy baby, on the basis that it wasn't the sex you wanted it to be.
Yeah.
And I think we have to draw the line morally somewhere.
Yeah.
Ethically and morally, we have to draw the line because staff tolerate it because they have to, but it's soul destroying. It's heartbreaking to go through it all the time.
And there's a huge exodus of midwives and nurses from the system. There's a shortages crisis in health.
Yeah, I'll never go back.
Yeah. Do you think it's because of some of these things?
Yeah, because we're not allowed to have opinions. We're not allowed to have personal views, especially as Christian women. We're not allowed to express any of those thoughts. I have seen it on one occasion where a doctor who was Muslim refused to see those twin babies that we talked about. So she refused to go into that room even, and she said it was on religious grounds. If I said that on my values as a Christian, I wouldn't get treated the same way. So it seems as though we're muzzled and told to be quiet, and you just end up falling into this pattern of desensitising yourself to everything that would normally be really affect you.
Yeah, wow. Well, thank you so much for coming today. I really appreciate you sharing your story with us. And
thank you very much.
Yeah, thank you.